Joining me now, St. Louis County Executive Sam Page. Thank you so much for being here. Obviously, a lot to talk about today. We had our first testing site open today, the drive-through testing. Is there any way that you can kind of predict how many people we might see turn up positive? A handful, dozens, hundreds, do you know? Can you say?
No, there's no way to predict that. We get a little bit of idea by what's happening on the coast, but what we're trying to do is limit the spread of the virus in our community while we stand up our community testing.
And you mentioned that we will be getting some more testing sites pretty soon, hopefully,
that's right.
within the next couple days.
I met with the chief medical officers of BJC, SSM, and Mercy on Friday evening, and we walked through their plans to have more testing sites by the end of next week. By Friday, we'll have testing sites in the city, in St. Charles County, and in North and South St. Louis County as well.
Obviously, we've heard from a lot of people who say, I think I may have some of the symptoms, maybe not all of them. I haven't traveled. Do you think we will then see the criteria sort of open up and people have more broad access to the tests?
Well, the criteria would be driven by the CDC and then by a consensus decision from the hospital systems and their leadership. But currently, the criteria is relatively narrow: to be symptomatic or to be exposed to someone who has traveled, or to be exposed to a known patient with coronavirus.
And just to remind people out there, I mean, obviously we want you to call ahead. If you think you might have it, there are some screening measures you can take.
Right. I think it's really important that people don't just come to the emergency room unless you're sick enough to be in the hospital. Otherwise, we like for you to call the hospital or call one of the call centers and get screened, and then they'll direct you to the proper testing site.
Now, yesterday you put in a pretty stringent ban on some gatherings, 250.
Right.
That was more stringent than the city's 1,000. Are you seeing people heeding the ban? Do you know if anyone is not?
You know, what we've been getting for a week is just calls with requests for advice and direction. And what I found in my discussions with faith leaders, discussions with municipal leaders and others in the community, they just want some direction. So we worked with our public health department, with our leadership, our technical advisory committee, to come up with a number that we thought was right for St. Louis County. One of the advantages we had another day to think about it and analyze the situation and see what's happening across the country. And we made a decision that was a little bit tighter, but it was a day later than the one the mayor made.
Now, I know Illinois has closed their casinos, for example. You're talking about guidance. People are wondering, what should I do? Can I go to the casino? Can I go to the mall? Should I go to a child's birthday party, for example? Is there just some best practices or guidance you would tell people it's not 250 people, but it's 10 too many?
Well, certainly if you have folks that are older that have chronic medical problems, we definitely would limit gatherings to groups of 10, and we would ask anyone with chronic medical condition where they may do poorly if they contracted COVID-19 to avoid crowds. And that's the guidance we had from the Surgeon General even a week ago. We would apply that same in our community. 250 folks in one small room would be about the limit that we would be comfortable with the information we have today, and that may change later next week. If we get new information, it may not.
We are avoiding crowds now, obviously, and hopefully we all heed that. An XFL player, though, has been diagnosed positive. Are the fans at risk? Should anybody be worried if they were previously in a big group?
Well, you know, generally if you follow the principles of social distancing, and unless someone is coughing or sneezing, social distancing is safe. 3 to 6 feet is a recommendation from the CDC for no more than 15 or 20 minutes. We think I think that's fine. I think that's safe. Anyone who watched an XFL game would be far away from anyone who is symptomatic.
And we just heard, of course, Ferguson Florissant now will be closing their schools. Any others you think, Parkway, Rockwood, should they consider that as well?
Well, I think all the schools are talking about that with their leadership. One of the problems with school closings is they have to work out a plan to make sure the kids that depend on schools for free lunch or reduced price lunch, that they have a way to make sure those kids get something to eat. A lot of kids in our community depend on our schools for not just for meals during the week, but also sometimes that's where they see a nurse or a doctor.
I know you've been working hard to communicate with the public, obviously, and kind of balance that being prepared versus people maybe having the tendency to panic potentially. Do you feel like you're doing a good job? I mean, should people have confidence in the government right now?
Well, I think so. You know, at the local level, we got out ahead of this. We started our emergency operations and communications really about 3 weeks ago. We started building this infrastructure. We started preparing, talking to our experts, and trying to get the hospital systems ready, and everyone's working well together.
All right. Well, thank you so much. I know you've provided a lot of information. We've been putting it out to the public, the hotline. There's places people can go for information, so we appreciate that.
Right.
Thank you very much.